I just want to say thank you so much for your support of the community mental health services in Shawnee County. We are deeply, deeply grateful for the more than 50 years of partnership that we have had in Shawnee County in carrying out our unique mission. It's hard to believe, 50 years. Time flies when you're having fun, doesn't it? And when we were, Frank was going to get up and speak this morning, and then when we looked at the budget hearing agenda, somebody said, Dick, they must have known that you were going to be the one presenting this morning because you don't have another one till 1 o'clock. So they thought, they know you're talking, you can talk till 1 o'clock anyway. So promise I won't do that. Promise I won't do that. But resources provided to public behavioral health services by the citizens of Shawnee County conveyed to us through your authority are essential building block for our local community mental health safety net. We couldn't do it without the support that Shawnee County has given. The accountability for all of our financial support from every source rests at the county level. We are honored by the trust you have placed in Valeo and all of our partners in providing the services, setting standards, and being stewards for the money that is allocated to us for operation of mental health services. We provide life-changing services in compliance with the laws and regulations, and we just appreciate having the opportunity to do that. Today, we're asking a lot because much of ask of us, your partner, in helping ensure that everyone who seeks recovery finds a wide open door. Our local system of mental health and addiction treatment has suffered for more than a decade of erosion of state funding as well as advent of managed care, both of which have left serious gaps in the delivery of services at the community level. We are pleased to announce that we see a little light at the end of the tunnel. 2019 has been a very challenging fiscal year for us, but some of the state funds have been restored and there are some gaps being filled. We still have a long way to go, but the filling of those gaps will be a long process, and we strive to respond to unmet client and community needs to catch up with our agencies and the benefits that are needed for the facility's operation and strength of our business operations. State grants do not, however, provide all of the funds needed to rebuild our system while responding to new challenges and the opportunities that come with that. Our request today for fiscal year 2020 is $2,500,000. If granted, we would direct the flow of these monies, as we traditionally have done, to meeting the needs of uninsured persons seeking services from the three partner agencies. Valeo's concentration for this additional county funds are going to be serving the uninsured persons in all of our required programming. Valeo's charitable care burden approached over $2 million for 2018. Our next priority is addressing behavioral health gaps highlighted in recent Shawnee County health rankings, suicide prevention and addiction that was recently reported. For example, two high-demand program areas for us as we step up to meet the identified needs are round-the-clock addiction treatment and mental health crisis intervention. Both of these areas of operation are highly and heavily used by uninsured persons and relate directly to the rankings report. Recruiting and retaining staff such as prescribers, security personnel, mental health technician and counselors in our crisis and detox programs, and staffing of our other areas of our operation are a priority. Provide a part-time psychiatrist or an APRN to prescribe medication at the rescue mission. We work very, very closely and in coordination with the rescue mission in the delivery of mental health services, and we're currently conducting a pilot program there. sustain staffing for our co-responder and CIT program and the alternative sentencing court, and add staffing for the behavioral paramedicine program. That co-responder CIT program is an essential services for our community, both for law enforcement and for the corrections department, because by dealing with them at the community level, they end up not having to touch the doors of the Shawnee County Department of Corrections. Each of the agencies represented here today will describe a little bit more of their services and the data in detail, and they'll share with you their goals for the use and increase of the 2020 funds that we're requesting. As our teams carry out their life-saving mission every day, and as we as board members support their work, the high standards that you have set for us to use of precious tax dollars are foremost in our minds. We look forward to our continued partnership in putting these dollars towards the most excellent cause, and that being recovery for all who touch our door. So with that, I am going to turn it over to Bill Persinger, CEO for Valeo, and he's going to talk in a little bit more detail about the specific Valeo budget requests.
Thank you, Dick.
Thank you all.
We did miss Frank, but you did okay.
Oh, just okay. Thank you.
Thank you, Dick. Bill?
Thank you, sir. Commissioners, Betty, thank you for this opportunity to review our needs and to present to you, the very critical services that we think the community, especially with the health rankings, has called for recently. Every conversation I hear, even when I show up at meetings where typically mental health doesn't show up, but people asking about this, what's happening in the area of homelessness and addictions and suicide prevention, and so we're just trying to do everything we can to step up and earn our keep. So part of earning our keep today, I think, is the reason we're here, to be accountable and to report to you what our needs are, but primarily to thank you for your service. For me, it'll be 4 years in November. One of the greatest pleasures I've had is to come report before this commission 4 or 5 times a year. You listen, you care, and we do appreciate it. And thank you to the staff at the clerk's office and the finance administrator's office for listening as well. I'll just make quick reference to the background. I know you're well aware of the history of public mental health, and that everything that happens in the community mental health center stems from the authority of a county to do so, either through its own actions or contracting with nonprofit agencies, which this county has a long history of doing. So we also present some information about financial and personnel information collectively and individually that the partners have. So there's some data there for you about our budgets, the number of persons we employ, our impact on the community, and so just make quick reference to that. From my perspective, and the conversations I hear around the mental health directors table, there are quite a few challenges facing our system, and like Dick referenced, there are some good news, but the uninsured and the underinsured are a very serious challenge. So when in conversation or in reports to accountable agencies such as yourselves, we talk about a couple of $1 million a year just from Valeo for providing charitable care, which we are obliged to do. That's who we are. It's what we do. We wouldn't be able to do that without money from the county and the state. But it is a burden, and it's a bill that has to be paid. We can't turn people away. And the 1.9 million and change that Valeo incurred last year is pretty typical. It's usually 1.8 or above. I don't know that it's ever exceeded 2 million, maybe by a little bit, but it always hovers around about 1 out of every 10 of our expense dollars is directly associated to the uninsured. Stigma about mental illness and addiction. All 3 of the agencies are doing what they can to fight that. Valeo has a fundraiser planned in the fall. It's our 3rd one. Darryl Strawberry is going to be here to tell his story of recovery and hope, and hopefully raise some money, but more importantly, raise some friends and raise some awareness and help fight stigma, so that when the conversation comes up about homeless person or an addicted person or a person who's suicidal, people really understand the context of what it is they're talking about. Workforce, in colloquial terms, just flat unable to compete with just about every other agency that hires human and health service workers, and social service just can't compete. We've managed to pass along some increases to our staff following some really thin years for increases, including some no increases. And even having hiked some pay and benefits in some critical areas, such as at our crisis facility here in town, our detox facility, still can't compete. It's really, really tough market in that $13, $15, $16 an hour range, with or without benefits. Hard to find people to go to work. So that's a big challenge, and it's one of the healing processes you hear us talking about, trying to use public money to help catch up, and so that we can hire staff to carry out these critical frontline street-based services we're talking about. Medicaid and managed care. I mean, our managed care companies are doing their job. They're bending the cost curve. We see the effects of that at Valeo. We have a number of services that just have to be provided, and when we hit those limits, the Medicaid companies quit paying. We keep serving people. We just keep going, because that's who we are, and that's in large part why we're here today. We need your help with the uninsured and people who don't have benefits for the care that they need. We have too few psychiatric residential treatment crisis and therapeutic residential beds for children and adolescents is also another concern statewide and locally. It creates a large impact on us. There are too few voluntary and involuntary psychiatric inpatient beds for adults. And we have difficulty keeping up with the need for increasing the cost of collecting and using outcome data. So our business operations, that piece of us that allows us to stand up and be accountable to our payers and our licensors and our funders to say what we're doing, how much we're doing, but more importantly, what impact are we having on people in society. That data is hard to come by. It's expensive to come by. I know at Valeo we've added a couple of staff in the data outcome department so that we can begin to answer questions when people who give us money want accountability. So we've been neglecting that part of our operations for a long time and trying to do everything we can to supply data, but we're still falling short, and data is going to be the key that turns success for us going forward. So I just want to refer you real quickly to the bottom of page 2. All of page 3. We could have gone on and on with some additional data, but we wanted to give you the highlights of some of the things we're able to achieve. Had a significant increase in demand for crisis care from the uninsured, and we've had quite a bit of an increase in demand for services out on the street. We've gotten involved with the behavioral telemedicine, or not telemedicine, with the behavioral paramedicine program. We've done a pretty good job of responding to the needs of social detox and the methamphetamine crisis that we see at our detox door every day. But there's some outcome data there for you to review, some what I call so what data, so sort of the what do we get for our money data, and I'll just refer you real quickly to that. Some of the initiatives and successes that we've had so far it had in 2018 and so far in 2019 are listed on page 4, partnering with Grace Med and others, responding to trying to maintain a low incidence of hospitalization by Shawnee County folks at Osawatomie State Hospital. We basically cut our admissions and cut our lengths of stay there by half in the last 3 years. Working with Heartland Visioning, working closely with the health department and others on the health rankings reports that have come out. I mentioned the fundraiser. We were recognized by consumers at the National Alliance for Mental Illness here in Kansas as a partner of the year. So just a few things to refer to you there on page 4. Back to page 5 now, if you'll take a peek at the top of page 5, specific areas of need for 2020 for Valeo. Some of these are ongoing needs, and very apparent here in 2019. Valeo's currently behind the curve. We're something like $800,000 in the hole right now, and it's going to be a tough year for us. I think that because of state grant increases, we're going to course correct for about 50% of that. So I've roughly reported, Angie and I, our CFO, have reported it roughly. We think probably about the end of the year we'll be behind $300,000 or $400,000. So we always seem to be about that close to breaking even. It's a tough road to hoe right now. Some of the grants that we got from the state last year probably won't come in the same strength that they came in last year. There will be some new grant money, but just not enough to meet those unmet needs. So again, serving the uninsured. For example, probably the one program that we run that's at the very tip of the spear, other than detox, is the 24-hour crisis program at 400 Southwest Oakley. We call it the Residence. It's the uninsured cost every month is $85,000. State grant money will pick up this year probably, let's see, about $500,000, maybe a little bit more. The rest of that, we're just going to have to, keep going and get by. So, if I had to stand up in front of people and say, what do you use our money for, this would be probably one of the primary things that I would, would definitely put up as not only a high cost, but a high need area. It's that program that keeps folks off the street, that allows our police to return to work as soon as they can when they bring someone to us. It's that program that helps keep people out of the emergency room. In fact, we've done a little study of our primary care program. We've cut emergency room utilization amongst a cohort of 400 or 500 primary care patients that we've seen over the last few years by 25%. That's a huge cost saving. So we know that some of those programs that get in first and deal with people first actually cut costs in other areas. At the residence, we need increased medical and psychiatric prescribing services. We need increased security personnel. We need security 24 hours a day at that facility. In fact, last year, I want to use the word held, but we provided a place to stay and treatment and supervision for over 50 people who had already been through court, had already been through due process, and had been ordered to go to Osawatomie State Hospital and could not get in for a half a day, 3 days, 4 days, 5 days. Held them per responsibility and provided treatment here in town until they could get into the state hospital. That requires medication. It requires security to be on standby in case there's an incident. Sometimes it requires us to call in additional staffing and work 2-on-1 with one to supervise one person 24 hours a day for a day or 2 or 3 till we can get them transported down to the state hospital. It's expensive and we need some more help there. So increased dollars would go, for example, to that particular need. And then also we need support for our municipal alternative sentencing court and related programs like CIT, the paramedicine program, and things that work right on the street with other staff, with other programs and staff. So with that, I'll stand for questions or comments.
Commissioner Cook.
Two of the programs that you've listed in the addiction program and the suicide prevention program do closely tie to our community health assessments and the needs assessment and our community health rankings.
Yes, sir.
As I'm sitting here thinking about our partnerships between the health agency and Valeo, Family Service and Guidance, where do we stand, in trying to can we do more partnerships or put in for different grants that maybe would be able to tie those two agencies and departments, you as an independent organization and our health agency, to maybe spearhead some of those preventions?
We are part of a partnership on a grant, a multi-year grant from Topeka Community Foundation to provide basically health care, out there where folks are, work upstream from emergency rooms, try to address those issues of food and safety and emergency room utilization, get primary care to people as early as possible. That's one thing we're doing. And we're involved in the paramedicine program. I probably list some other partnerships. The state has reduced its funding for our co-responder program that we had, and I think we've got all 3 of those shifts filled, basically where we have a social worker on the street with the police 24 hours a day. So Valeo's stepped up and provided, some additional funding there. City has trimmed funding for the municipal alternative sentencing court, which of course keeps folks out of our county facility and off the street and back to work and in treatment where they need to be as an alternative to sentencing and conviction. That support from the city used to be around $65,000 a year. It's down around $25,000 now, and we're grateful for it. But again, we've maintained an effort there and done everything that we can for that partnership. And we're all the time looking for new grants and new opportunities, and have reported on those in the past. But standing here today, I don't have a list in front of me, Commissioner. But we're all the time looking. We visited with Linda and her team a couple of times, staff to staff. Our management teams have gotten together to talk about things that basically to educate each other on what we're doing, keep the communication going, and so.
I just think we're going to have to be very creative this year, and when it comes to the budget, and meeting with the Audit Finance Director Greiner in preparation for the budget hearings. I believe that we are really looking at maybe less than $1 million total. Once we make adjustments for salary increases that we've already contractually obligated to, we really have less than $1 million total to allocate amongst everybody. And I know that your request is, 630,000. And so I think we're going to have to get creative this year, as we do every year, right, Commissioners?
It was real close last year, $10,000, I think, is about
Yeah.
the breathing room you had last year when everything was said and done. It's close.
So it's just going to be a tight year.
It will
as they
be.
always are.
It will be. And I can tell you that any increase that Valeo, our share of any increase you would pass along, we could definitely focus on those programs that are out there on the street that augment what the sheriff and the police are doing, that the rescue mission, such as the prescribing clinic at the rescue mission, and being able to do those services right there at the rescue mission. Things that work as far upstream as we can is where we want those dollars to go.
Well, the commission has said very clearly and unequivocally that addressing mental health, addressing addiction, addressing suicide prevention, especially within our teenagers and our young people, those are key priorities for this commission because they do closely tie to our overall wellness as a community, and not just the health rankings. The health rankings is just a number on a piece of paper, but meeting the needs of our constituents and the people that reside in Shawnee County. And so we've placed that as a priority, restoring funding to mental health and working to get back to where the cuts had been made to restore back to mental health where it had been. And so we're going to continue on that path unless...
Well, we want our gears to mesh with others, so applying those dollars where other wheels are already turning to keep it going is partnership is where we put those dollars.
Good, thank you, Commissioner. Commissioner Rippon?
Well, Commissioner Cook stole my thunder. I wanted to talk about teen
I can repeat
suicide.
myself.
But I also, you mentioned in your report here about expanding services in schools. What does that look like? Is it,
I'm going to punt to our partner, Family Service and Guidance Center.
Okay.
Commissioner, if you don't mind, either now or when they get up, but Brenda?
Do you want me to talk about it now, or?
Sure.
Wait till after?
I don't know, that,
Go ahead.
Okay. Okay, so your question specifically is what expansion of services in schools?
yeah, I'd just like to know what your involvement is and how you work with the schools and what schools and.
Okay,
Is it
well-
all the schools within the whole county or?
Sure. Well, we've always had staff that have gone in to work with specific clients in the schools. This past year, we had a special project with USD 501. It was actually a pilot that 5 or 6 mental health centers and school districts around the state did, where we placed licensed clinicians and mental health case managers in the schools to work with a school liaison at the school to try to address needs of children who were maybe not accessing services for whatever reason. Transportation, families reluctant to come to the mental health center, just a variety of things where we had kids that were not functioning well in the school system, and the folks who are around them every day are recognizing that there's something going on, so they would get referred to our program. We saw about 150 new children this past year who would not have had services otherwise. We also, Washburn Rural and Shawnee Heights approached us about doing a similar sort of program in those two school districts. I think it was last summer. Was it last summer? Ed and I went around and met with all the superintendents about what can we be doing along with you and your resources to augment what you're doing. And the schools, I know they always have a shortage of resources in the mental health area. So we've been pulled into a variety of activities with the schools, and so those are specific for clinical work that we're doing in the schools. And in addition to that, I could talk about our suicide prevention initiative, if you want to hear about that now.
Sure.
Okay, so hopefully you've seen something about that in the press. It's called Suicide, Talk About It, Save a Life. And we came together with all the area superintendents and Hayden High School last year in the summer to address the alarming increase in suicide amongst our young people. It's increasing across the country. It's increasing across Kansas, but we were, of course, focusing here on Shawnee County about we've got to do something about this. And so it was a collaboration of the Suicide Prevention Coalition, Family Service and Guidance Center, and all of the area, all county school districts. It was kind of like enough is enough. We all know that there's something we can do together. All the districts provided staffing resources to this initiative, and that the best piece of it is that we brought students from the schools into this process. We've continued to meet with those students on, I think, a quarterly basis, Pam. Pam knows a little bit more about this than I do. On a quarterly basis, they provide us a wealth of information about what's going on the front lines. How can we interact and approach them in a different manner? And, you know, students are going to talk to students, and so they have been incredible in their efforts in helping us to help them in suicide prevention. I think that, you know, the data is still out as to whether we've seen a reduction. Anecdotally, in the numbers I do have, I think we did see a reduction in suicide attempts, successful attempts this past year. I don't know whether it's as a result of our efforts or not. We'll hope that it is. This is something we are very passionate about continuing through this next year, that the advisory group has continued to meet with us. We are adding some technology-driven methods for the students to be able to interact with others on, it's called 7 Cups. That's the product that we are supporting and purchasing. And the kids can just text to trained listeners about whatever issues, whether it's they're suicidal or if it's just that, you know, they're having a difficult time with a breakup with a boyfriend. We're getting great results back on that. We are not the ones that are doing the listening. That's trained listeners that are listening on that are tied in with the 7 Cups program. But what we can get is data back that says, in your community, we're seeing an increase in calls or text communications about these sorts of issues. We have data that shows that if there was a successful suicide attempt in a particular school, we see a big increase in the number of electronic communications about this. So kids are, you know, we're seeing this kind of ebb and flow of what's going on in the community, and so that it'll help us to be able to target when we need to be out there and working with the schools on, you know, particular issues that might be rising to the level of stress for the kids. So I'm telling you lots of stuff. I could talk about this forever. I could talk for a long time about this, Bill, but you have some more specific questions?
No, I was going to ask about 7 Cups.
Yeah,
I think
yeah.
you covered that.
It's very cool, and we've had, you know, we're anxious to get this rolling into the next year. And the students were great about helping us roll this out. We had some posters that we had designed. We were going to have those put up. And Pam and her folks showed them to our advisory board, and they said, no, nobody likes that. You need to do it this way. So they gave us feedback on the best way to approach kids. So it's just really been a fabulous partnership involving the students and the mental health professionals at the schools and the mental health professionals in the community. So we're excited about it. And actually, is it Shawnee Heights? Those students actually came up with a full-blown suicide prevention program that, you know, it's a booklet, and they are all really active about it and getting new people each year that will be able to carry this thing out. So really cool stuff has come from this. And we're 1 year into it, but we want to keep that rolling. So anything else about the schools? Okay.
Any other
No.
questions?
Further comments or questions?
I have a few things to add to Commissioner Rippon. New commissioner, you need to get used to Commissioner Cook stealing your thunder.
It's not intentional.
But it happens all the time. Yeah, I can't think of anything sadder or more heartbreaking than a young person committing suicide. That's just incomprehensible, the pain and grief that goes along with that.
Yes, sir.
This is a high-level question. In our health department, we have problems hiring people. Stormont Vale has, and I think countywide there are like 3,000 jobs that are unfilled because we just, and so, you know, the supply and demand, wages are going up. And I think the economy is just roaring. Unemployment is down. Because the economy is doing well, and a lot of baby boomers are retiring. Some of us don't have the sense to do that at this point.
Yeah, I'm with you on that one.
But in all seriousness, unemployment's down, the economy's doing well, so you would think that the need for social services would be going down because people are employed, they're, generally doing well, and the mindset would be, if you're employed, you're actively working, and, you don't suffer with a lot of mental illness that comes with being unemployed and not having a job. So explain to me, and this is a high-level picture, but the unemployment is down, the economy is doing well, and yet the need for social services continues to rise. Does that make sense?
On the surface, you'd think that things would be better, and I don't think I have a clear answer. I have personal opinions, but I think that, the fact that we've been able to talk more about mental illness and addiction, the fact that, maybe only the recovery is recent and it hasn't hit everybody. I mean, the folks that we take care of, many of them live on family incomes of way less than $20,000 a year. So that stress and strain is still there. We know of consumers who work a couple of jobs, $9.50 an hour, trying to make it, raise their families. They don't have health insurance. We know that more physicians and other practitioners are spotting mental health problems earlier because of the education and making referrals. I think probably in mental health, we've extended ourselves so far into the community that people know we're there. They're calling more often. Maybe they have time now to think about some of their problems, and, maybe those daily hand-to-mouth needs are maybe not so prevalent amongst perhaps maybe the middle class. But I can tell you, people in the lower socioeconomic classes who, struggle every day to pay rent and utilities and put healthy food on the table, those are the folks we've reached out to, and they're responding. And sometimes I feel like we ought to pull back and pull the shades down and say, well, don't call for a while. let us respond to the demand that's there. But of course, we can't do that. I don't know that people in a lower socioeconomic class, Commissioner, have seen the kind of recovery at 8, 9, 10, 12 bucks an hour that perhaps some of us have, who enjoy salaries and benefits. And those of us who do have salaries and benefits, maybe now that we can relax a little bit, have the time to think about, okay, what are our personal problems, and move into some help for that. But I don't have a really good answer. I could probably, launch into the integrity of the family unit and how that's waned in the last 40 or 50 years. And in fact, I think a lot of the programs that we operate, and I know that the health department and GraceMed and others are trying to install programs that work well ahead of, okay, how can we strengthen the family bond? How can we keep that boundary there for children to grow up in a healthy environment? That produces more work, not only, in children's services, but adult services as well. And I just don't have a good answer for you, other than I don't think people in the lower SES socioeconomic class have seen that kind of recovery. I think they're still feeling the stress and strain.
Well, I think you have some good insights, and I know Linda, our health director, has some good insights. It's just
part of it's build it and they'll come, and we have built it in response, trying to do our collective work, and people are continuing to knock at the door. It'd be nice to see a slowdown. I mean, we're meeting those needs. We're not there yet.
Commissioner, I can say that from the people that I work with in Shawnee County, it's a couple of different levels. We have a very wide, Topeka and Shawnee County is known for our mental health and for access to mental health. And so it's not uncommon to have a very large transient population that will stop in Topeka for assistance or help, or come to Topeka because of, it goes back to Meningers, it goes back to the state hospital days. And so you have that reputation within the state, within the country, of this is a place for mental health. And so that's one of the factors. For our young people, social media. That is driving the depression, that's driving the suicide rates, the social addictions, and addressing those social addictions early. Family service and guidance, they're doing more active work earlier on than we've ever seen before, trying to address these issues before they become adults. We also see the cutbacks in the state in funding for state hospitals, which then gets pushed onto the counties, because as they either sit in our jails waiting to go to Larned for an evaluation on criminal cases, or they sit in our state, they sit in our mental health facilities waiting to get a bed in Osawatomie, and you might get a bed for 72 hours. How much work are you going to get done in 72 hours? If you're in crisis, not a lot. So what's left is the counties are picking up the burden from the state
And the city.
and the city. And we see that cutbacks, and then we still have a large methamphetamine issue in Topeka. We really haven't seen the opioid crisis hit Topeka like we have in other parts of the country, but methamphetamine is still, and heroin has sneaked its way into Shawnee County. We have a big heroin issue that we don't want to talk about, but it's here, and it's hitting our population. It's very addictive, and when you're talking about heroin or methamphetamine, it takes a lot to get free from those. And so we see our courts ordering more people to treatment earlier on. It's just an overall burden on, systematic burden on the, so I appreciate what Valeo Breakthrough House providing daily services to individuals with mental health so that they're not just wandering the streets, and having them have an issue of purpose, and being able to have payees so that they have people that are not taking advantage of them financially, meeting their daily needs. And so it's trying to address what we can. But it's systematic through from birth to death. So
I concur, and I think that the recovery we're seeing in the middle and upper income levels, I hope, will provide, more resources for us all to work with for people who are the most vulnerable. It's part of what keeps me going every day after, 41 years in the business, so.
it goes back to our employers when they say they need employees to show up every day, on time, drug-free. If you're suffering from addictions or mental health, you're probably not going to show up every day, on time, drug-free, which is why we have this gap in our workforce. And so we need to figure out how we can get them there, on time, every day, drug-free. So.
A lot of the goals and objectives we have with our adult consumers are those very kinds of things that where mental illness has interfered with their organizational and planning skills, and many years of a disease has just robbed their personality of zest and vitality. How do you get yourself organized? How do you handle your finances? Let's go look for that job. Let's do this, let's do that. We contact with over 150 employers at any given time, and we know those very practical skills are what we're trying to get people to relearn. People who had skills when they were 18, 19, 20, and before if you let me use the word breakdown, before things really hit and those symptoms appeared, trying to get back to some really practical skills and things that will help them be able to move up economically and find a decent place to live and reunite with family. It's a tough question, though, Commissioner. I wish I had an easy answer.
I agree.
No, I think the discussion is good, and
Thank
I
you.
appreciate Commissioner Cook's and your insights.
Thank you.
And, I think it's just frustrating from our perspective to see so many unmet needs in the community.
I know.
So, Betty, did you have anything for?
I did have one question.
Bill?
Yes, Betty.
You had made the comment that you have decreased emergency room visits.
Mhm.
Have the hospitals been willing to partner with you financially because they are seeing that benefit?
We are working with, Stormont Vale Foundation has provided some giving to the mental health center, and we have increased our communications back and forth with the emergency room, and do move people back and forth with our own personnel and theirs providing that transportation. But we have not received any direct funding for that particular objective. We continue to look for a primary care partner in the future, and hopefully one of the agencies around who does primary health care every day will help us sustain that site at Valeo, which is the only primary care practice in a community mental health center in the state of Kansas. Other than maybe Prairie View may have services down there. I'm not sure, but we are continuing to look for a healthcare partner. The $250,000 that we got from the St. Francis Foundation about 2 years ago, year and a half ago, continues to sustain us, but it won't last forever. I think if we had to exist on fees only, it wouldn't be able to sustain itself. We're looking at that partner, and in fact, that's some of the uninsured burden that we're having now, just trying to take care of those individuals. But nothing in large amounts of money yet directly. So
Because
It's a thought.
I would think that they are getting a financial benefit from that,
think
because
the
a lot
cost
of those
avoidance,
people are
yeah.
uninsured.
right. Yeah, the cost avoidance there we know is significant. That's just primary care. We know, I know that our other impacts, our programs have an impact on that as well. The relationships are good with both hospitals and GraceMed and other health providers, but, other than the health partnership that was created for the Topeka Community Foundation, their transformational grant to get health care way upstream to people who are most vulnerable, I can't think of any major funding streams yet, but it is on our minds as we build relationships.
Very good. Anyone else want to address the commission before we adjourn?
I'm going to, if you'd permit, Mr. Chairman, I'd like to introduce Brian Knudsen with the Family Service and Guidance Board, and then I think we're going to have comments from Breakthrough House if we
Okay.
can continue.
Absolutely.
Thank you, sir. Appreciate that. Brian.
Thank you, Commissioners. Commissioner Archer, you're correct. Commissioner Cook can steal some thunder. If I could just replay his comments on the state of our community, I would probably just sit down and say thank you. But I appreciate your comments, Commissioner Cook. So, yes, so my name is Brian Knudsen, and I have the pleasure to serve as the chair of the board of Family Service and Guidance Center. I've lived in Topeka for just about all my life, and I work as a CPA in this community for the last 18 years. Like many people in Shawnee County, I didn't know a lot about family service when I first joined the board. But what I have found is something more than I could have imagined. As you can tell, it's a group of people that really care about what they do and they care even more deeply about the families and children that they serve. So it has been just my pleasure to learn more and more about this organization. Part of it, growing up in this town and kind of what I would consider a normal childhood, the things that I have been, my eyes have been opened in working with family service, the problems and the issues that some of the kids in this community deal with were just something I never could have comprehended. So I'm very thankful that we have organizations like this that provide that safety net, that are there to help these kids, that can make changes in their lives now, so that down in the road in the future, they can hopefully have a better life going forward. But I will try to provide a few brief statements. Brenda's already stole some thunder on the activity with the schools and 7 Cups, but I will make a few brief statements, just a quick summary. Family Service and Guidance Center is a licensed community mental health center that specializes in pediatric behavioral health services. We provide outpatient therapy, psychiatric, community-based, and crisis services. Along with Valeo and Breakthrough House, we provide the public behavioral safety net for Shawnee County. You'll find our staff, as Brenda mentioned, working in schools with students. We also work with pediatricians, law enforcement, juvenile corrections, child welfare agencies, and TARC and more. We partner with Stormont Vale, GraceMed, Valeo, and others to promote community health and wellness. We employ about 328 individuals, represents 278 full-time positions in this community, and that staff provides over 228,000 hours of services to 5,300 children. Another 6,500 children and caregivers participated in community outreach efforts like Happy Bear, if you've ever heard of that program, mental health, first aid, and applied suicide intervention training. Last year, a big issue that came up was suicide prevention, and Brenda has dealt with that already, so I won't mention this a lot, but that was one of our big initiatives during this past year. Along with that, as she mentioned, that we launched our initiative for suicide, Talk About It, Save a Life. I think Brenda has done a better job than I could of explaining what goes on there. A few other items that of note. Family Service and Guides, we have hosted, and maybe you've seen this on KSNT twice this year, we've hosted basically a Ask a Child Therapist, where people could call in and speak to a child therapist. Give somebody an opportunity that maybe wouldn't normally come to the facility or come in for services. We've also, during this last year, Family Service and Guidance Center brought in a speaker that spoke to all the high schools in this community and gave presentations at TPAC, that somebody that was a survivor of a suicide attempt. And that's just been another very successful initiative that we've taken on to help prevent suicide in this community. Other activities, in the 2018-2019 year, Brenda also mentioned this, this was the first pilot year in which therapists and case managers worked in 501 facilities. We also provided services in Shawnee Heights, Washburn Rural, where we saw about 175 children that we hadn't seen before. The autism program has grown, and we're able to negotiate better or improved Medicaid reimbursement rates, and we'll be able to start treating children with Medicaid coverage in August, further expanding our program. We have excited to have recruited another board-certified child psychiatrist to Topeka, and she joins us next week. Family Service and Guidance Center has engaged in a strategic planning process for our future, in which we've developed 5 goals that include business plan development, workforce recruitment and retention, comprehensive quality measures, and business analytics development, and CARF accreditation. As far as our needs in the future, you've already spoken about it. Our biggest number one barrier is covering the the shortage in our workforce and being able to provide competitive wages to our folks. We need to maintain momentum of the suicide prevention program and grow our autism program as well. Our community needs this expansion in the autism program. With that, I'll stand for any questions, but I'm trying to really shorten what's already been said. So,
Questions?
No, thank you.
thank you very much. I'd like to bring up Sheena. She's with Breakthrough House.
Okay, thank you so much for being here.
Good morning, Commissioners. My name is Sheena Ward. I'm currently serving as President of Breakthrough House Board of Directors. I've been serving on the board since 2016. All of you have summarized, Commissioner Cook, many of the experts in the room, everything that is pressing with the mental health community thus far, including Breakthrough House. So I'm not going to stand before you very long. I just want to summarize some things in support of our organization. On behalf of the staff and the consumers of Breakthrough House, I just want to say thank you very much for your financial support of our organization throughout the years. We're now well into our 41st year in serving the Shawnee County residents who live with severe and persistent mental illness in our communities. We're extremely grateful for your support, and we reiterate and concur with the request for additional funding. Much like many of the people in this room and the people that they serve, additional funding is needed to shore up their budgets. Breakthrough House has really not recovered since 2011 when the recession hit and funding was reduced to our organization. We suffer in that regard. Organizationally, structurally, we would like to provide additional funding for our staff, some of which who are only paid under $10 per hour. If we were able to do that, the funding that we would use and be provided will be used to make improvements to our property. We get property violations at times. We have aging facilities, and we need to, make some very much needed repairs so that we can minimize that and ensure that the properties that we have are safe for the individuals that live there. We have an aging vehicle that we need to replace. It has required us to reduce the number of trips that we're able to provide, supporting our individuals, the individuals that we serve, getting to and from areas in the community where they need to go. And we also like to, like I've already indicated, pay a little more to the people that are our support staff and fulfill the mission of the organization. Our main outcomes are increasing the stability of our consumers, decreasing our consumers' issues with law enforcement, and reducing consumers' misuse of illegal drugs and alcohol. To that end, in 2018, 97% of our residential consumers remained stable and out of a mental health facility. 94% of our consumers avoided having issues with law enforcement, and 97% of our residential consumers remain clean and sober. We work towards improving these outcomes by providing, like I already said, safe places for our people to live, safe places for our people to go, which is our flagship program, a clubhouse that they go throughout the day. As Commissioner Cook indicated, it's somewhere for them to go, for them to socialize. They work on skills, identifying goals, and keeping their life stable. A few of our partners are Valeo. We work closely with a team effort with their case managers and treatment professionals. We work with the VA, their social workers and healthcare workers. We partner with harvesters in the Shawnee County Master Gardeners program. I really don't have anything else to say. I just wanted to summarize that so that I didn't reiterate a lot of what you already know. a lot of what has already been said, but I am willing to stand for questions at this time, and we also have our Executive Director, Lynn Davis, in the room, who can also answer questions if you have any.
Very good, thank you. Commissioner Cook? Not stealing any thunder
No,
again?
I'm done.
Commissioner Rippon?
How many people do you average a day that goes through your?
Well, in a year, we come in contact with over 500 individuals. Daily, we average about 33 people that we serve in our clubhouse, who visit our clubhouse. So, and we have, how many residents in our residential program?
We are at capacity right now, 32.
32.
What's the average length of stay there?
Would you come to the microphone? We're broadcasting.
I'm Lynn Davis, Executive Director. Right now, we're at capacity for 32. We have 32 units available. The average stay is, I would say, once they're there, it's at least 2 or 3 years. We have some that have been there for 15 years, 20 years, going on 20 years. It's a permanent facility. It's not transitional. We don't have any transitional residents. So we do rely on Valeo as far as taking in the transitional residents when they come out of Osawatomie. But once they're stable, if they're able to go into our licensed group homes, we have 2 of them. That's where they go, and a lot of it is, they'll stay there. Most of our residents, once they're there, they do like it. We try to transition them into one of our independent apartment units. We've got one of our group homes. It's very convenient. We've got an independent apartment, a house with 3 units across the street. So they are even able to come over and benefit from the meals in one of our group homes. So we try to involve not only, the group home residents, but our other residents. We've got basically, 7 to 10 residents that live in independent group homes. We try to involve them as much in the meals. They can come over and partake of meals in the group homes if they can get there. And the ones, of course, that live across the street from the group home, that's real convenient for them. But we do, once they're there, they tend to really stay. Not much change in the residents. So, any other questions?
Thank you. I don't see any.
Okay, thank you so much.
Thank you.
I'll just close by saying we thank you again for your time. One thing that I like about Breakthrough House, I was sharing with the individuals earlier, is that, the funds that come through our nonprofit organization are going to further stabilize the individuals so that can ultimately reduce the costs. Organization like ours do help people become stable and live a more average, normalized life, so they aren't having to come to community mental health centers and get more services, so they aren't having to be in our other facilities like jails and hospitals, further increasing our costs as we face national and worldwide issues that, like access to information, access to social media, that further perpetuates mental health issues in our world, and certainly in our communities. It's something that, we ought to give a little more thought to, and we will make sure that any additional dollars that are provided are used at their greatest potential. Thank you.
Thank you so much. Do we have any follow-up at all? Okay. Thank you all for coming today. It
And
is.
if you do have any follow-up questions, feel free to reach out to us.
We
We'd be
will.
glad to
We will.
help in any way that we can.
Okay. We appreciate your coming today very much. Our next session is at 1 o'clock, where we discuss the court's budget, and then at 2 o'clock, our Department of Corrections budget hearing is. So, again, thank you for coming, and we're officially adjourned until 1.
Thank you.
Thank you for your comments on how the stormwater order. I think it's really great.
Well, I think it does benefit the hospital financially.
There should have been some discussions about that a few years ago when they started releasing people over there. I was like, I just need to know. I'm gonna start.
Okay.
Bring it up again.
I'll get you, yeah.
Yeah, I'm taking my vacation kind of one Friday at a time. So a lot of campers don't use that. Well, the bank might be